We rolling?
Yeah.
Okay, we have one of Yo-Yo's patients. We have Dee Dee. Hey Dee Dee.
Hello.
How are you today?
Okay.
You're okay? You're okay if we video your procedure for all our friends on YouTube and around the world on the internet?
Yes.
You've got a little bump. You've got something odd on the back of the left knee. How long has this been here?
A few weeks.
A few weeks.
A month or so.
Okay. And did you have some kind of injury or something that might have gotten this started?
I fell on it 10 years ago.
Really? Is it possible it was here longer than that, but it just started bothering you recently?
It's possible that here.
So we're just going to make a little incision and remove this. Oh, do you have some forceps for me? Yes, you do. We're just going to make a little incision and remove this for you, send it off to pathology. We think this is a granuloma, which is just an inflammatory nodule. We don't think it's any more serious than that, so I don't want you to be overly concerned. But we are concerned enough to take it out. It's very small. I don't know if you can kind of see when I depress the skin a little bit there, we get a little bit of a, you almost have to feel it. All right, you're going to feel a little stick, sting, and a burn. Gonzalo's going to spray some cold spray. Are we all ready?
Ready.
Let's go.
Sorry.
Good. Stick.
Sting and a burn. You okay? Actually, you said my phrase. I'm supposed to say it.
I know, but you haven't been here in so long that you kind of forfeited it.
No, you just took over.
That's what I do. Gumby's been saying it for you.
Scalpel.
All right. If you feel anything, you're going to tell me, okay?
Okay.
If you feel pressure, but you shouldn't feel any pain.
Oh, I feel pain.
Did you feel pain?
Yes, I felt that.
Okay. Let's get a little more anesthesia, please. Yeah, we definitely don't. We definitely want to not feel pain.
Yes, we definitely do.
Right.
My dentist always has to give me extra shots too.
Really? That is fascinating.
Probably because it doesn't work as fast and as it.
Well, some people are, a little more resistant to it.
It is lidocaine with the epinephrine. You okay?
I'm all about that, yeah.
Can you feel that?
Nope.
Good. We're going to stop right there.
It's hot in here.
It is warm, isn't it? Now I'm going to try to feel that little granuloma and move it around to where I can grasp it and remove it. There it is right there. I feel it right there. This reminds me of removing a splinter or something almost.
Is that kind of what it is like?
Well, it's an inflammatory nodule, and we wouldn't normally remove these, except it's bothering Dee Dee a lot. It's really an annoying area. Isn't that right?
Very much.
What causes this?
Inflammation from mild trauma or infection. You feeling anything, my friend?
Nope.
What do they look like?
They're little nodules. Look like really small BBs.
Okay.
And I'm feeling it right there. There's a little connective tissue or scar tissue around it, and we're just going to pull that apart, and we're going to remove this. I am definitely feeling it right there.
I can hear it.
Did you hear it? It's
You're
definitely
pulling it, yeah.
right there.
You're getting scar tissue. I see it.
Yeah. How's school going?
I am ready for finals to be over.
Oh, yeah?
Yes.
Oh, you have your finals on Monday,
All next
right?
week. I have it.
There it is right there. See that little
Yes.
nodule? That is our granuloma. So that's going off to pathology.
It looks like
That
a
was just
fish egg.
Little, did look like a little fish egg, didn't it?
Mm-hmm.
She still have more.
I don't know, but I do feel a little bit of a nodule right there, and I don't want to did. Actually, had two little granulomas, huh?
Do I put both of them in here?
Yep. There's the other one. Shows you
Oh
where.
wow, that's a big one.
It looks about half the size of a kernel of corn, I would say,
Yeah.
Dee Dee.
Wow.
You're going to enjoy seeing this on the video, I think. Alright, we'll send all that and we'll put a little stitch in here now. It's just I could almost put just a steri strip on this, but because it's in the back part of the knee, you're more likely to have a lot of stress in that area, so I'd feel more comfortable with it going into the weekend if we put a stitch in there.
Okay.
And in a week, you can remove it if you want, or just come back in and I'll take it back out for you.
Okay.
Alright. One quick stitch.
Where do y'all practice when you were a student to stitch?
Oh, we
ER.
practiced on each other.
No. I see the med students, they like, over a patient, they're like, because they'll
Oh, yeah.
do a procedure on them. You should see that when they're trying to intubate a patient. Oh god.
Oh my god, you
They
have to
like fight over it.
you have to record that and send it to me. I wanna see it.
Intubating?
Yeah, I remember I was at Bentop and they brought in a guy.
You're right. I'll put a dot.
I will be really surprised if you even have any scar at all with this.
Yay.
So you are done, stitched up. That comes out in a week. Like I said, you can come back and we'll take it out. That's actually pretty easy. You could remove that one in a week if you like. Next.
Hey there, Dr. Gilmore fans. We have an update about Cocoa Skin Plus. It's the newest supplement from the marvelous mind of Dr. John Gilmore. The proprietary mix of high-potency biotin, extra virgin coconut oil, and vegetable extracts is great for thicker hair, stronger, healthier nails, and softer skin. So if you notice your hair lacks luster, your nails aren't what they used to be, or your skin is dry and chapped, it's time to check out Cocoa Skin Plus. I've personally found that it's way easier to prevent chapped lips than it is to treat them. And I used to take a coconut oil supplement for it, so switching over to Cocoa Plus was an upgrade for me. It was for Kelly too. Let's hear from her.
I used to take regular biotin for thicker hair, so switching over to Cocoa Skin Plus was a no-brainer.
Nice. We'll put an Amazon link below, so get your 90-day supply today.
Meta 7 combines 7 vital nutrients that boost your metabolism. These essential nutrients boost your energy level and may even help you lose weight. The goal of Meta 7 is to help you activate your life. So if you are feeling a bit sluggish and want your energy back, try Meta 7 today.